So thanks, Milton, for having me. It's, you know what's tougher than a big crowd of people? A big crowd of people post-lunch. So this is my lunch break. I decided to hop on over. My name is Ben Tan. I am the Market Development Director for IoTG Health within Intel. So I am based in the Galactic headquarters down in Santa Clara. So I'm going to spend my lunch break meeting with everyone here. It's an awesome opportunity. So at Intel, healthcare is really a continuum of care that ranges from the data center all the way to the edge. So a big recurring theme that you will hear everything about Intel these days is how do we apply compute, AI, machine learning, both big and small. So the specific area that I focus on is in mobile health, in a segment we call remote patient monitoring. We do have teams that service medical products. We sell core computing capabilities into north of 640 medical appliance categories today, the highest being, Xeons in MRI machines and X-ray machines, all the way to pretty portable IV administrative products. So we also have edge compute capabilities, what we call healthcare enterprise, that is around taking data from very specific OEM measurement peripherals. If you look at your typical admission care, you're going to probably find some 20 devices at the patient's bedside. How do you actually take all that data and make sense of all that at the edge, right? So that's our enterprise solution. But today we're going to talk about mobile health, and specifically this is called the Intel Health Application Platform. As opposed to high dollar, which is on the cloud side, this is high volume and low ASP products, which we bring to the market through OEMs. So distributed care, a couple of quick stats around this, one of which is the CAGR, right? So I've spent a quick note about myself. I spent the last 16 years of my career in consumer technologies. This is my 5th month in healthcare, so a lot of bigger brain cells than I am in this room. But what is interesting is the CAGR of global telemedicine growth. That's close to 20% over the next 5 years. We are seeing a market that is growing at 16.8 CAGR through 2021 for emerging healthcare at the edge, which is what this device does. And there's been a lot of effort around reimbursable improvements that enable and remote care as a standard of care, which of course at Intel is a big part of, to push telemedicine into patient homes. Now our strategy is a little bit different between the Americas and Europe and the rest of Asia, primarily because of how healthcare is driven in each of these different markets. In Europe, it's notably social and welfare, so our go-to-market strategy is pretty different over there. But bottom line here is that this is anything with a CAGR of about 20% is extremely exciting for Intel to participate in, which means we take some of the brightest engineers, we'll put them on a project to create everything that we need to cover on the health continuum. So specifically, as I mentioned, the product I'm responsible for is called IHAP. At Intel, we try to put an acronym to everything. Well, this one actually has 4. Usually it's about a 3-letter acronym. But essentially, the IHAP platform is one that enables the patient to be remotely monitored by the caregiver. It's about, at least in North America, it's about reducing readmission rates in the first 30 days for the same condition within a care network, right? Simply put, we work, our core market really is remote care service providers. So we work with ODMs and OEMs to build these devices. These devices then get sold to remote care service providers, which then get service in a care network. So I call it a B to B to B to C business, right? So it's not exactly B to C here. It's a little bit more complicated than that. So most of our customers will actually implement a care program for the top 4 or 5 conditions, COPD, chronic heart failure, diabetes being some of the more popular usages of a device like that. But in essence, this thing is about connecting typically to Z-Wave, Bluetooth Classic BLE devices, whether it's your weight scale, your blood pressure cuff, glucometer, spirometer, et cetera, secures that information over here and sends it either wirelessly or through the cellular network into the healthcare provider's EMR. So in other words, this is a very expensive Android mobile phone. It's enterprise grade, of course. But what we've done a lot is it's essentially a lockdown system, right? So the point of this is to make sure that there is a end-to-end solution that the care provider or the care service provider is able to own and control from end to end, rather than relying on an iOS device, on an Android device that you buy that's a BYO sort of technology. On the other end, as I mentioned, the continuum of care really allows us to take any information that comes through here and do any sort of edge learning or inference, as well as rely on the cloud for that. So we have technologies around, AI is a big thing at Intel, and there are many layers of AI we apply to healthcare as well. But in terms of a lower end product like that, most of the use cases that we have is around patient activity levels and looking at some of the spikes and changes over the course of time to best predict what kind of care they might need or the change in the level of care. Okay, there we go. This is the last slide. I'm very light on slide. I think that this is a lunch break for me. So the health application platform in itself is something that Intel builds as a reference design. We then licensed this particular reference design to a company called Flex. They were previously known as Flextronics, one of Intel's many ODM partners. This product then typically would go into either an OEM channel, one of the big medical peripheral manufacturers, or a remote care service provider. So essentially this product, which comes out of Flex factory, gets sold into two channels, OEMs as well as remote care service providers. Typically what happens is that these get kitted along with a number of different peripheral devices, which based on conditions that they want to monitor have different kits. You might have a weight scale plus blood pressure cuff. You might have one that includes a spirometer for COPD. And ultimately, these get inventoried by remote care service providers and then drop shipped into the patients. So the important thing to note about this product is that Intel does not own any of the data, right? Secondly, that this is considered health IT infrastructure. In effect, what comes out of the Flex factory is not an FDA-regulated device. It's no different than a mobile phone, except it's got a much higher level of security. It is completely cloud agnostic, and it allows you to add your own flavors of AI and applications on the platform. So in a sense, it is open, but in a sense, it's also a little bit walled garden for the remote care service provider. Doing okay on time? All right, so as I said, this is, I tried to make it pretty short, sweet, simple. At Intel, we will cover a broad spectrum, so if anyone is interested in speaking about anything on genomics and cancer research in the cloud and all that stuff, that all ties into a lot of what we do at the edge as well. Like I said.
Thank you so much. We have some time for some questions. Yeah, questions.
So a lot of the devices, so we support three distinct classes of peripherals, your Bluetooth Classic, your BLE, and the Continua class of devices. So this in itself supports Continua, and will support the Fire standard come Q1 as well. So our responsibility is really in connecting with peripherals. The RCSP's responsibility is in integrating with EMR systems, right? Neither Intel nor Flex holds the right expertise to integrate with EMR systems. That's what our ecosystem partners do.
Any other questions? Okay, one question I have, so there's a bunch of company out there do this for remote patient monitoring. They have their device with a blood pressure cuff, with glucometer. They will connect to their mobile phone. How, for people who are used to that model, why would they use this?
I think it's about kitting, it's about simplicity, right? So this, believe it or not, has a very low resolution. I think it's about 240 pixels in terms of display resolution, as opposed to a pretty complicated phone where you might get push updates and things like that, distractions, right? So we've started about 5 different clinical trials with partners this year, and overwhelmingly, about 95% of what we see coming back is the simplicity of use. This literally has 2 buttons, on, off, function, that's it.
So this one, you can control those devices as well? Like
you can absolutely control the device. You can pair it with a mobile app if you want to do peripheral onboarding. You can actually also do things like, if you don't like the display for this and you want to extract all the data from here, which we have 2 different databases, FDA and non-FDA, you can actually do that in conjunction with a mobile device. But the goal here is to make sure that this is super simple to use. Yeah.
Awesome in there. Any other questions before? Okay. Great. Thank you so much, Ben, for sharing. Thanks. Thank you so much.